opioid epidemic is a problem for our patients here in Brockton.
It has been the biggest health crisis that I've ever seen.
We knew that we had a lot of gaps that we kind of wanted to fill in, especially with the pediatric side of things. So when we received the funding, we were really excited.
Who had a positive craft?
The craft is a series of 9 questions that will determine if the patient wants or does not want to receive help with a substance use issue.
Basically, our craft was not being administered, getting the teens input by themselves without parents looking over their shoulders saying, what are you doing? So we had to really kind of retrain and update our workflow.
We gave a lot of our MAs some language around explaining to the parent why it was important for the child to do it, why it was important that the child did it on their own without the parent looking over their shoulder so that the child could give more honest answers.
The way that we revamped the system was to take the craft screening tool into the room where the adolescents are weighed and measured instead of given to them at the desk when they first check in. And then they're told that this is between them and their provider.
I'm going to give you this paper. It has questions on it. It's very confidential on you. And
it's to help us help them for any services that they may need or any questions that they have either with them or their families or friends. And then it's given to the provider before they actually are in contact with the parents.
Youth prevention is critical to solving this problem.
To talk to someone about your addiction.
United Voices is a teen group that we run for teens to ask questions about relationships, sexual health, drug use, substances. We decided to collaborate with the Brockton Area Prevention Collaborative. They were able to teach our teens about all the different substances. With that information, kids came up with a couple of different projects.
Welcome to the Hidden in Plain Sight exhibit.
It's a setup of a teen's room, which was already something that was created that has different cues for a parent to see that the child may be using some substances. Our kids put their own little spin on it for things that they knew that wasn't necessarily in the original Hidden in Plain Sight exhibit.
Once you twist this off,
oh my goodness,
they could hide anything in here.
This is just an exhibit to give you a chance to start a conversation with your child.
So they could just be hiding this underneath the pillow, flip it over, you just think it's the regular one. Yeah.
The kids had a panel where they talked to parents about their own experience with drug use and allowed parents to ask questions about how to talk to their teens about use. Our staff learned how to administer the curriculum about the different substances to the youth. Ultimately, it opened up a conversation for youth to feel comfortable to have conversation with their friends about their use and about substances in general.
And it was a lot of role playing.
I don't. Try it.
You should really try it.
I'd rather not. My mom wouldn't like that.
I was extremely happy to be able to be a part of the Learning Collaborative. The support from other health agencies, while we're so different and populations are different, the one thing is our work always kind of drives us to want to do better for our patients. And so I think that was at the core of everything, like being able to pick up ideas was awesome.
Ways that we can help them minimize.
The CVS grant allowed me 4 hours a week that we could plan, take time to make sure that we were getting the screenings, capturing those kids that really needed help, educating the staff, which is the ripple effect. They all saw the Hidden in Plain Sight. Most of them are moms. It gave them a way to influence their own families, who many of them live in the community here too.